Today's topic for discussion is International Health Agencies, a study of WHO, UNICEF and UNDP. To introduce the discussion, the United Nations organization, founded in the year 1945, has several specialized agencies. The work of the specialized agencies is multiple and extensive, specifically covering issues concerning health, sports, education, environment, disaster management, livelihood, conflict transformation, world's peace, etc. The World Health Organization, popularly known as WHO, the United Nations Children's Fund, UNICEF, and United Nations Development Programme, also known as UNDP, are among the key specialized agencies mainly working in the field of health and other associated themes. International health organizations work as an agency for health-related issues. The functional nature of the health agencies are generally divided into three types. 1. Multilateral organizations. 2. Bilateral organizations. And 3. Non-governmental organizations, also known as NGOs. One of the primary themes that connects the interventions of WHO, UNICEF and UNDP are its commitment to themes of the UN Resolution number A/RES/67/296, which aims at establishing an umbilical link between healthcare issues and physical fitness from the early childhood. Such an idea of health and fitness has resulted in the deepening of the meaning of healthy life conditions and development. In order to raise awareness of this potential, 6th April has been declared as the International Day of Sport for Development and Peace, also known as IDSDP, by the UN General Assembly. The adoption of this day signifies the increasing recognition by the United Nations of the positive influence that sports can have on the advancement of human rights and health, development and peace. Types of health agencies. Let us examine types of health agencies. The term multilateral means that funding comes from multiple governments as well as from non-governmental sources. The World Health Organization is the premier multilateral international health organization as it is an internationally consented agency. The World Bank is an intergovernmental organization. Bilateral agencies are governmental agencies in a single country which provide aid to developing countries. The largest of these is the United States Agency for International Development, popularly known as USAID. Theoretically speaking, most of these agencies are meant to be autonomous organizations which, by special agreements, work with the UN and each other through the coordinating machinery of the Economic and Social Council, also known as ECOSOC. According to ECOSOC's Constitution of 1948, its principal goal is, I quote, the attainment by all peoples of the highest possible level of health, unquote. Health agencies and their multiple initiatives. Let us examine health agencies and their multiple initiatives. The interventions of the health agencies are specific since they concentrate their activities on particular themes and issues. For example, WHO focuses on generating a global monitoring health mechanism while setting up norms and standards for international health systems. UNICEF deals with children's education, welfare and development, while UNDP focuses on health, education, sports and youth employment. In conjunction with WHO and the World Bank, UNICEF sponsors a special program for research and training in tropical diseases. The activities of the health agencies such as WHO, UNICEF and UNDP can be discussed as below. The World Health Organization. Let us begin with WHO. The World Health Organization was established as a specialized agency of the UN in 1948. More than half of the UN members ratified WHO when it came into existence officially on 7 April 1948, which is today celebrated as the World's Health Day. The founding charter of WHO is known for its high ambitions as it objectively declares for, I quote, the attainment by all peoples of the highest possible level of health, unquote, with health being very broadly defined as, I quote, state of complete physical, mental and social well-being and not merely the absence of disease or infirmity, unquote. With this objective in mind, WHO supervises and coordinates health initiatives around the world. WHO initiatives on health cover the eradication of smallpox, cholera, HIV, and typhoid, etc. WHO adopts a holistic approach to health issues as it pays equal attention to an overall healthy environment through awareness to prevent chronic diseases, people-friendly medical policy, proper sanitation, cleanliness, fighting drug abuse and addiction. Structurally speaking, WHO has multiple structures of health governance. The World Health Assembly meets once a year to approve the budget and decide on major matters of health policies. All the 190 or so member nations send delegations. The World Health Assembly elects 31 member nations to designate health experts for the executive board, which meets twice a year and serves as a liaison between the Assembly and the Secretariat, which carries on the day-to-day work of WHO. WHO and sports. Since 1984, the World Health Organization has been organizing sporting events all over the world to encourage healthy lifestyle. WHO's commitments to sporting events is associated with its fight against drug abuse, unhealthy lifestyle, and tobacco use. WHO's vision also sees crucial link between sports, physical activities and health. Under the aegis of WHO, significant health programs like the 2008 Action Plan on Prevention and Control of Non-communicable diseases, also known as NCDs, and the 2004 Global Strategy on Diet, Physical Activity and Health have been developed and endorsed by the World Health Assembly. The documents have come to provide a primary guideline to providing healthy childhood. Another interesting initiative in this regard is the WHO Technical Meeting in December 2009 on population-based prevention strategies for childhood obesity. According to WHO estimates, the prevalence of childhood obesity worldwide is increasing, with more than 22 million children globally now classified as overweight. In order to control the increasing obesity among the children, WHO continues to sponsor sporting events in association with the governments. WHO initiative on sporting activities have the following objective concern: policy awareness, children's health, active participation of UN members, prevent childhood obesity, research, documentation, intervention and monitoring, etc. Let us now talk about the role of UNICEF. The role of United Nations Children's Fund, UNICEF, in the field of improving health has been no less significant. UNICEF, initially known as the United Nations International Children's Emergency Fund, was established by the General Assembly in December 1946. The objective was to help the needy children, particularly those who were affected by the Second World War. The UNICEF was made a permanent UN organization in 1953, monetarily supported by the donations of the UN member states. It has helped providing food to children in more than 100 countries around the world. UNICEF takes off the monitoring responsibilities under the Convention on the Rights of the Child. UNICEF spends the majority of its program resources on physical health and youth development. UNICEF dedicates its services to the protecting and supporting of the world's most vulnerable children, particularly those who come from poorer countries. Its primary focus is on the children under the age of 5. For example, in 1994, UNICEF received about $1 billion in contributions, 70% from governments and 30% from private sources. In 1994, UNICEF spent about $202 million on child health, $81 million on water supply and sanitation, $30 million on child nutrition, and $216 million on emergency relief. UNICEF runs many of the child health programs in cooperation with WHO. One of the significant aspects of its interventions is in the field of sports and extracurricular activities. UNICEF has tied up with internationally renowned sporting institutions to spread the message that good health is intrinsically rooted in sporting and its allied physical activities. We will now examine the role of UNDP. The United Nations Development Programme are at present operational at least in 166 countries. UNDP is the UN's global development network, focusing on the challenges of good governance, poverty reduction, energy and environment, and HIV/AIDS, etc. UNDP also coordinates national and international efforts to achieve the Millennium Development Goals aimed at poverty reduction. UNDP is credited for regularly publishing the annual Human Development Report, which consists of an overall statistical report on the state of affairs in the world. UNDP's work on rule of law, justice and security seeks to enhance physical and legal protection of peoples and communities, ensuring legal representations, access to justice, and empowerment of communities and civil society. Consolidated programs have been developed in Afghanistan, Bosnia, Herzegovina, Burundi, Central African Republic, Chad, Colombia, Democratic Republic of Congo, Haiti, Iraq, Kosovo, Liberia, Nepal, the occupied Palestinian territory, Sierra Leone, Somalia, Sri Lanka, and Sudan, etc. UNDP also has a considerable rule of law, justice and security portfolio in the development context. The global program on accelerating access to justice for human development was launched in 2009 to focus on strengthening and expanding UNDP's ongoing engagement and contribution to rule of law and access to judicial services for the poor and vulnerable in over 90 countries worldwide. The main focus has been on ensuring rights of people from a bottom-up paradigm. The objective is to increase people's legal protection, opportunities and choice so that they are empowered to defend themselves and improve their lives and economic sustainability. UN and sports. Annually between 2003 and 2007 and biannually since 2008, UN member states have unanimously adopted a series of resolutions all entitled Sport as a Means to Promote Education, Health, Development and Peace. Recognizing the potential of sports to contribute to the achievement of the Millennium Development Goals and noting the potential that sport has to contribute to the well-being of societies. In 2005, Resolution 58/5 proclaimed 2005 as the International Year of Sports and Physical Education. In 2008, Resolution 63/135 welcomed the integration of the Secretariat of the Sport for Development and Peace International Working Group into the United Nations Office on Sport for Development and Peace under the leadership of the Special Advisor. Aptly responding to the initiatives of UN, non-governmental organizations, also known as private voluntary organizations, provide approximately 20% of all external health aid to developing countries. The largest NGO devoted to international health in the United States is Project Hope, with an annual budget exceeding $100 million. Worldwide, the most important NGO in long-term international health is probably Oxfam International. Founded in the United Kingdom in 1943, it now has affiliates in 10 other countries, including the United States. Recognizing the importance of sustaining momentum around the development potential of sport, UNOSDP performs the following duties. It holds conferences and issues reports. It spreads awareness about health benefit of sports. UNOSDP was instrumental in organizing the Olympic and Paralympic Games in Beijing in 2008. UNOSDP also serves as the official secretariat for the Sport for Development and Peace International Working Group, an intergovernmental policy initiative whose aim is to promote the integration of sport for development and peace policy recommendations into the country and international development strategies of national governments. To conclude, the role of UN health agencies is so enormous that it has to work in multiple ways in order to produce a holistic approach to global health policy engineering. Despite